You'll feel a little pressure here, that's normal. Let that all fall. Good. Good morning, everybody. Welcome back to Kalkstein Chiropractic. It's Dr. Warren here with Jessica. And hey, Jessica.
Hi, how are you?
We are great. Good morning.
Good morning.
So Jessica is a server. She's local to the area. Are you also in school, Jessica?
Yeah, in nursing school.
So she works full-time and in nursing school. She's got a heavy course load, and she's been dealing with this neck pain for 2 years. So she came in to see us in the beginning of July is when you started coming in to see us, and you came in with a pretty bad spasm in your neck in terms of a muscle that was really, really tight and not letting go. That's like a true definition of a muscle spasm, right? And you had a positive indicator of pain in the area. You had decreased range of motion in your neck. And so we started doing some work with you, and you got dry needling done, you've had some soft tissue work, and now we've upped up the amount of physical therapy that you're getting in the office, right?
Right.
All right, tell me a little bit about it. You've had this problem for quite some time, and you love your dog a lot, but...
Yeah, he's definitely the reason that I think it happened. It's been going on for like 2 years. It's definitely progressively gotten worse, like the amount of time it's been like sore, and like how bad the pain has gotten has definitely gotten worse over the last 2 years. And I feel like it's gone from my neck and reached into kind of like my collarbone and shoulder area. So it's time to do something about it.
Yeah, I'm glad you're coming in to see us, and it's been a trip up to that point. How's your experience been so far, and how's it been feeling?
My neck feels a lot better. I don't really feel much pain in my neck anymore. I've definitely noticed like a lot less tension and tightness in my muscle in my neck. So that's really great. Now it's just this area, but it's a tricky muscle, so I think it's a lot more tricky than the neck muscle. Yeah, so
she had a couple areas that had tension. So the one that she's kind of referring to down by her collarbone, there's a muscle called your omohyoid, and it comes into the hyoid bone, but it's got a second part that comes back, and they call it the swimmer's muscle. A lot of times swimmers that do butterfly and turn their head in that butterfly position, they elongate that muscle and they can strain it during that, and you were just reaching over to pet your dog over here, and that aggravated it potentially, and that's one of the muscles that we're working on, as well as the upper trap and the scalenes on the left side. And we come into a muscle called your subclavius. So she just had a good session with Art, one of our massage therapists here recently. So in terms of the amount of soft tissue work that I'm going to do with you today, it's going to be minimal. I'm just going to focus on that muscle called your omohyoid, and then we're going to show you as well as a re-exam for her neck, just to take a look at how she's moving overall. So the reason that we're doing a PT program with her with a muscle spasm is she's got a pattern on that left side. When she goes to serve or when she goes to use her arm in any positions, she tends to tense the anterior chain of the muscles through her scalenes to her trap, and she guards in this area instead of just using the shoulder like it should be used, right? And so we've been training you with that, and you're working with Jonathan and Sebastian, and you're getting much better at your exercises, and that's going to continue to support us as we calm things down. So it's not just treating the symptoms, it's treating the cause of those symptoms is what we're going after there, okay? And that way you have a good experience in our office.
Exactly.
Yeah, all right, I'm done talking. I'm done too much talking. We're going to get started here, okay? Jessica, come on over here and just stand right behind Tegan for me, okay? That's perfect. So go ahead and turn your head to your right for me as far as you can comfortably go. Good, and then come to your left side. Good, 10 degrees less left rotation. Go ahead and face me compared to right full rotation. Extend your head back for me. Good. Come back down. Really full range of motion. Chin down to your chest. Better. One finger. Good. Is there any pain in any of those ranges of motion?
No, I mean it's like a little sore right here, but it's not to the point where I can't move it.
In which direction do you feel a little soreness right there? When you rotate towards it or away?
Away, like when it's pulling it. Like I feel it. It feels kind of good, like it's stretching, but it's definitely like a tender kind of like pull. Okay,
gotcha. And I'm gonna bring your head back again for me, okay? Good. I'm gonna rotate you towards this side. Is there any pain with that?
No, it's just like a little tender, but not pain.
Right through here? Okay, gotcha. So I'm gonna have you go up on your back for me. So with these type of problems that come into the office, there's a couple things that I want to look at. I want to look at the range of motion in the neck and break that range of motion down in quadrants. So I'm looking at extension with rotation. But I also want to check just how the fascia is moving in terms of some of that neural tension that can be there with these type of problems. So there's a reason those muscles are guarding. Sometimes it can come just from tension around some of the nerves that come from the neck, right? So we just need to loosen up the joints, the muscles, the fascia, and so that these nerves can glide nice and smoothly and the body doesn't tense up when they feel that they're under pressure, okay? So do me a favor, just let me know, do you feel any pulling pain into your fingertips with this?
Mm-hmm.
Do you feel it right down the center?
I get my finger.
In your fingers like this? And turn your head to your right. Does it change at all?
Try again.
Okay. No wrong answer here, okay? Turn your head to your right.
Yeah, it's like
more intense through here? Just a little tingling sensation?
Mm-hmm.
Okay. Now go ahead and turn your head to your right. Any change?
I just feel it more. It just gets a little bit more intense, like the pull.
Where?
Like in my forearm.
Through here?
Mm-hmm.
Okay, gotcha. Anything in the fingertips at all? No. Go like this. Good. And then I want you to pretend like you're drinking a teacup in front of you. Yep, like this. Take your elbow and bend it, like I'm doing. Yeah, there you go. That's all right. You've never done this before. I don't expect you to get it right. And then I want you to turn it upside down, all the way. Good. Now turn your head to your right. Any symptoms with that?
Mm-mm.
No, good. So just a little tension along that median nerve. So that's something I want to look for. And that could just be forearm tension, right? That's just something I'll add to the things that we're getting objective measures with as we work with her. Okay, so relax that shoulder for me. So she's also doing a strength program out there. She's going through posture exercises, and then we're also getting measurements with what's called a functional movement screen. So we're going to look at the way she moves globally, not just in the neck and the shoulder, and we're going to treat around the symptoms. So sometimes just supporting the body in different areas. So if I have an upper back complaint, sometimes just getting flexibility in the hamstrings and getting support in the core will change the symptoms in an upper back. So it's not always just taking a microscope and going right to the problem. Sometimes we look globally, a lot of times we look globally to address the problem in multiple areas. Good, let this drop. Loose. There it goes, good. Loose. And relax here. All right, just on the corner, not on the collarbone. She's got a little, some people, my friend in chiropractic school had this as well, so it's not abnormal, but she doesn't like pressure on her chest or her collarbone area here. She just doesn't like it. She don't like it.
No.
So I'm just doing an AC joint mobilization. You okay with the pressure?
Mm-hmm.
Is it just sore in that area?
Mm-hmm.
Is that where the massage was work? Yeah.
Yeah.
So you can be a little sore after massage if you're watching this and you're wondering. I went to a chiropractor, I went to a massage therapist, or I went to a PT, and they did a lot of manual work with me. They did a lot of soft tissue work with me, and I was sore afterwards. That can potentially happen. It's about mitigating that soreness with good rest and making sure that you're treating each person as an individual, because everyone responds to care differently. Turn your head to your right for me. Good. Come back to your left. And relax here. Let your shoulders loose. Good. I got you here. Let it all go. Good. So one indicator for a good adjustment is if people do the happy dance with their feet. Jessica's known to do the happy dance if I have a good adjustment with her. So I got a good double paddle there. So, actually, we're going to do a different adjustment. Okay, Jessica. You're going to come sit over here for me.
Okay.
So, I don't normally work on the omohyoid, so forgive me if it takes me a while to get my hands in the right place. Okay. Yeah. So, you're going to do me a favor. You're going to take your head and turn towards me and tuck your chin down. Good. Now you're going to take your head and look to the right as far as you can comfortably go.
Still head down?
Yeah, still head down and then bring your head up to neutral. Good, now look back for me. Good. Keep going back, keep going back. Good, come back. There. That pressure right there. Is that pressure okay for you?
Mm-hmm.
Okay. Turn towards this corner. Now rotate to the right and then look back. Nice and smooth, just like that. Now head back, 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 back. Good. Is the pressure okay still?
Mm-hmm.
Okay, does it get a little more intense towards the end?
Yes.
Okay, turn your head to your left, tuck your chin. Go ahead. We're going to go through this 5 more times. Nice and smooth. You're controlling the motion. Good. Again. Good. Turn your head to your right more. There you go. Good. Jessica, are you counting?
This could be 4. Are you counting?
I am.
Okay.
Back again. I'm going to go a little deeper.
Okay.
Good. Right there. Hold. Breathe. Exhale. Extend back. Right there. Is that where it gets pretty tight?
Mm-hmm.
Yeah. Okay. I'm on that spot. I'm going to go one more pass here. Okay, stand. So, I had this question in school a lot, like, how many passes do I do when I do soft tissue work? Like, what's the magic number? Well, if you just think about that, right, it's kind of silly. There's no magic number. It's feeling the tissue relax under my hand, but also being patient with the patient, because it's not, you're not going to get everything done in one visit. You don't want to do too much. A patient will be sore. It's about doing the right things in the right amount of time, and that's how you get people better. So sit down a little bit lower for me. Good, just like that. Okay, and relax your head here. Okay. Good, and what you're going to do is put your hands on the side here for me, just like so. Let them hang. And just close your eyes and relax. I'm just going to palpate the joints in your upper back, okay? So let your back relax. Good. Good. Let your shoulders drop. Let this loose. You'll feel a little pressure here. That's normal. Let that all fall. Good. Okay. Very nice. Come on up for me. Stand up. All right. So, ready to work out?
Yes.
Let's do it. Thank you for watching. You got to watch how I worked on someone with the shoulder problem that had muscles tension in the front as opposed to the back, and the muscles included omohyoid, the scalenes. She had a little subclavius and some pec tension as well. And we've been working on that, but just for today, we did the omohyoid muscle, we adjusted her cervical spine, and we did a range of motion re-exam with the KEMS test or compression test in the neck as well. So she's doing better, and we're going to keep getting her to feel better and do more active therapy as she feels better. All right, thank you for watching, everybody.